Welcome to Digestion and Physiology, Series 5, Part 2, Macrominerals, Calcium. In the previous clip, we explained the difference between macrominerals and trace minerals. We are now going to talk about each of the important minerals, starting with the macrominerals. Firstly, let's look at calcium. It is one of the most abundant minerals in the body. It is stored in bones and is a key component in the formation of bones. Calcium is essential for bone and teeth development, normal muscle and nerve function, and is an important component in blood clotting, amongst many other functions. Homeostasis, which we explained in the previous clip, is extremely important when it comes to calcium in the body. Calcium concentration in the blood is kept within a very tight physiological range of between about 80 and 120 milligrams per litre. Below that, or above that, a physiological response occurs within the body using hormones, particularly the parathyroid hormone, to increase or decrease the absorbance of calcium. Unlike most animals, including humans, horses readily absorb calcium into the body. Most other animals require a combination of the parathyroid hormone and vitamin D3 to regulate calcium absorbance. With horses, this is not an issue. Calcium absorbance is usually somewhere around 50 to 60% of the quantity in the diet, regardless of the amount needed in the body. The homeostasis regulation affects how much is retained by the horse, not how much is absorbed. Horses will absorb a lot of calcium from the diet, but if there is already over 120 milligrams of calcium per litre of blood, then much will be excreted in the urine. If it is under 80 milligrams per litre of blood, then everything that has been absorbed is going to be retained and used to keep this homeostasis. When there is not enough calcium being absorbed to get the blood levels back into homeostasis, the body then starts drawing the calcium down from the bones, remembering they usually have a very high store. As for sources, it is well known that milk is quite high in calcium. Other sources include green leafy pastures, particularly legumes like lucerne and alfalfa. Limestone is about 40% calcium carbonate, so it is a particularly good source of calcium. There are times when horses need an emergency calcium inclusion in the diet, like when faced with oxalate grasses such as buffel grass. Agricultural lime is approximately 40% calcium, meaning 100 grams of agricultural lime is going to put 40 grams of calcium into your horse's diet. It is cheap and effective. On the other end of the spectrum, grains are very low in calcium and are very high in phosphorus. On average, your horse needs to absorb about 2.5 grams of calcium per 100 kilograms of body weight, just to replace that which is lost through normal physiological functions, or what we call obligatory losses. When talking about a 500 kilogram horse, 12.5 grams needs to be included in the diet before any other benefits can be gained. As a result, you will find the horse's calcium requirement is somewhere around 20 to 50 grams per day. As I mentioned before, it's very easily absorbed in horses, meaning its bioavailability, which we explained in the previous clip, is somewhere between 45 to 70%. Something that is talked about a lot when it comes to horse nutrition, but not well understood, is the calcium to phosphorus ratio. Most people believe it must be 2 parts calcium to 1 part phosphorus. That is, twice as much calcium as phosphorus. In fact, that's the middle point of the ratio. Ideally, you are aiming for somewhere between 1.5 parts calcium up to 2.5 or even 3 parts in certain circumstances calcium to 1 part phosphorus. The 2-to-1 ratio is just an average, a middle point, not a necessity. When you have excessive phosphorus in the diet, that is, less than 1 part calcium to 1 part phosphorus, calcium absorption is greatly reduced. If you get to a point where you have 1 part calcium to 3 parts phosphorus, you will find the calcium absorption will fall by as much as 50%, which can lead to major health issues, particularly relating to bones and muscles. This can occur in instances where your horse is on a high grain diet or in an area where there is a high level of oxalates within the pastures. Vitamin D is not essential for calcium absorption in horses. It is extremely important for ruminants, cattle and sheep, and particularly important in humans as well, but it is not needed to regulate the calcium absorbed in horses. Vitamin D can easily be sourced from exposure to sunlight. In Australia's conditions, where we have regular hours of sunlight, you are unlikely to see a vitamin D deficiency in horses. In areas like the Northern Hemisphere, where horses are housed for long periods of time with artificial light, up to 6 months of the year, due to the poor weather conditions, then vitamin D in the diet is necessary. Horses can deal with a diet high in calcium. To compensate, they excrete a lot of the calcium via the urine. But remember, it's an energy expense. Calcium also has the potential to increase the pH in the blood, creating an issue of metabolic alkalosis. You do not necessarily want to add it just for the sake of doing it, because it is not going to help your horse. Try to stick closer to the recommended levels, and if you have issues like high oxalates in the diet, you will need to add more, but you do not want to be excessive. The problem with having excessive concentrations in the diet is that extremely high calcium intake will reduce the absorption of other minerals, particularly phosphorus, magnesium, manganese, and zinc. It is important to understand that too much of some minerals can negatively impact on the uptake of other minerals in the diet, creating deficiencies. Adding more is not necessarily better. In fact, in a lot of cases, more is worse. It causes a physiological response. There is a point when there is an optimum inclusion in the diet. Any more and a negative response will occur, getting worse as more is added to the diet. When there's not enough calcium in the diet, the body draws calcium down from the bones. If there's a calcium deficiency in the diet, or excessive phosphorus levels, then bone development, structure, and density issues are likely to occur in your horse. With young horses, if there's a calcium deficiency, or too much phosphorus causing a calcium deficiency in the diet, then these young horses will most likely develop skeletal issues, which come under the reference of developmental orthopedic diseases, or DOD. For mature horses, conditions like osteomalacia are likely to result, ending up with severely weakened bones which are more prone to breaking. Another condition is osteoporosis, commonly talked about in humans, which causes the same sort of issues with the older horse. If your horse's diet is low in calcium, or there is reasonable calcium but excessive phosphorus, or your pastures are high in oxalates binding up calcium, it is likely your horse will suffer from a condition called hypoparathyroidism, better known as big head. Hypoparathyroidism results in the bone being stripped of calcium. With big head, what happens is all the bone in the facial part of the head is stripped away, broken right down, and is replaced with fibrous connective tissue. You end up with this enlargement because the fibrous connective tissue just keeps growing and growing, whereas bone gets to a certain maximum point and stops. The result is an enlarged head which, once it gets to a certain point, cannot be corrected. Alternatively, if there is not enough calcium in the diet, you end up with a condition called hypocalcemia. This does not usually happen because of inadequate calcium in the diet. It is more likely because a lot of the calcium is either not being used or being lost. This could be due to metabolic alkalosis, a rise in the pH in the blood. This can occur after the horse has done a lot of physical work, and you might have worked them a little bit too hard. That results in them overheating and gets a lot of calcium pumping through the blood, causing the blood pH to rise. Calcium is then stripped from the blood to try to lower the pH as quickly as possible. The easiest way for the body to do this is to send it to the kidneys and out in the urine. When the horse cools down, with the now greatly lowered calcium concentration in the blood, upsetting the homeostasis, the body goes into panic. It tries to draw the calcium out of the bones, but this process could take several days to occur. If the calcium is not replenished quickly, your horse can suffer from shock, muscle fatigue, and if it is not corrected rapidly, a coma. Hypocalcemia can be an issue, but it is one you can deal with very quickly through dietary response. Your key takeaway points from this clip include: calcium is one of the most abundant minerals in the body of the horse, falling into the category of macrominerals. Calcium is essential for bone and teeth development, normal muscle and nerve function, and is an important component in blood clotting, amongst many other functions. Calcium levels are tightly regulated in the blood, easily absorbed into the body, and has a high bioavailability. In normal circumstances, the horse excretes excess calcium and draws down calcium during times of deficiency from stores in the bones to maintain homeostasis. Excreting excess calcium is an energy expense. Oversupply can also reduce the absorption of other minerals. Long-term deficiency can lead to bone disorders such as developmental orthopedic diseases in younger horses and osteomalacia and osteoporosis in the mature animal. The calcium to phosphorus ratio in the diet is particularly important as phosphorus can make calcium unavailable. The ratio should be somewhere around 2 parts calcium to 1 part phosphorus as a median point. Green leafy pastures are high in calcium. Beware grasses high in oxalates, where calcium may need to be supplemented. Grains are low in calcium and high in phosphorus. A horse on a high grain diet may need additional calcium in the ration. Thank you for watching Equine Digestion and Physiology Series 5 Part 2. If you like what you saw, please give us the thumbs up and share it with your friends. Connect to our website, our EqNC Facebook page, and Instagram, so as not to miss our next series.